Hello, welcome to NAU's Cannabis 101 module. This module is self-paced and geared to provide you with up-to-date info on all things cannabis use and weed. The goals for this module are as follows. One, we want to understand the science behind cannabis. Next, we want to learn about the way cannabis affects the body and the brain. We want to make sure we know about the relevant laws and policies surrounding cannabis at NAU and in Arizona and throughout the US. We want to ensure that we understand the difference between low, moderate, and high risk cannabis use. And we want to learn about harm reduction strategies when it comes to cannabis use. Lastly, we're going to take on key interventions and strategies to both identify and help a friend who might be struggling with cannabis use. Before we get into that, though, let's take a moment to go over some common beliefs, both true and false, surrounding weed. Why? Well, we tend to make decisions based off of our knowledge of things like risk to self and others, impacts on the body, our understanding of science, and our belief about what our peers, neighbors, and society considers normal or acceptable. So, the first step in identifying whether to engage in cannabis use or how we talk to a friend who might be struggling with a substance use disorder is to make sure our information is correct. For instance, you might have heard that cannabis isn't addictive, especially when compared to other substances like opioids and alcohol. However, the fact is that about 10% of people who use cannabis form an addiction or a use disorder, 15% if use begins before the age of 18. On the inverse side of that, you might have heard the old adage that cannabis is a gateway drug, meaning that it leads to gradually risky use or addiction to other substances. However, research shows that the majority of people who use weed never go on to use supposed hard drugs. In college, there might be the expectation that most students are smoking weed, but that isn't true either. According to a 2021 survey, less than half of NAU students used weed at all in the last year, with just 5% reporting having used cannabis in the last month. Lastly, and this is a big one, there's a myth that you can't overdose from weed. Whereas overdosing from weed is far less likely to be fatal, you can experience an overdose that leads to things like nausea and vomiting, psychosis, and trips to the hospital. So knowing what's accurate and true is key in things like reducing stigma, deciding what behaviors to engage in, and how we engage in those behaviors.